Hi, my name is Linda. I am not a medical professional, and the information in this video is for information only. If you have any worries about your condition, consult your healthcare professional. I was asked a question, are scoliosis and osteoporosis related? In this video, I shall explore the difference and relationship between scoliosis and osteoporosis. They are two different medical conditions that mainly attack the spine and skeletal system, but they can also be related in some ways. I shall explain the connection between the two and explore each condition's causes, symptoms, treatments, potential links, and much more. But first, what is the definition of scoliosis? Scoliosis is a condition that attacks your spine and causes your spine to curve. An X-ray can measure an angle greater than 10 degrees, and the spine can curve either to the left or right, often in an S or C shape. The condition can develop in children, teenagers, or adults. The impact can vary widely. You could have mild symptoms with almost unnoticeable curves, or you may experience significant deformity that can become a health problem. There are many types of scoliosis that can be classified into different types based on the age of onset, underlying causes, and severity of the curvature. The types include: idiopathic scoliosis is the most common form of scoliosis, especially in adolescents. The causes are unknown, and it can be further subdivided into infantile, juvenile, and adolescent scoliosis. Congenital scoliosis. This occurs due to vertebral defects current at birth, where the spine develops abnormally during fetal growth. Neuromuscular scoliosis. This type causes neuromuscular conditions such as cerebral palsy, muscular dystrophy, or spinal cord injuries. It is associated with conditions that weaken the muscles or nerves, such as muscular dystrophy. Degenerative scoliosis, also called adult-onset scoliosis. It occurs through wear and tear on the spine's joints and intervertebral discs, and is typically seen in older adults. Degenerative scoliosis is linked to aging and spinal degeneration, which includes conditions like osteoporosis. Functional scoliosis is a temporary form of scoliosis, usually resulting from muscle imbalances or leg length discrepancies. The symptoms of scoliosis could range from mild to severe, and can include uneven shoulders or hips, a visible curve in the spine, ribcage protrusion on one side, pain in the back or neck. In severe cases, it can attack the lungs or heart function. When this happens, you could become fatigued. Treatment for scoliosis depends on the severity of the curve, your age, and the type of scoliosis. Some options include observation. For mild curves, especially in growing children, intermittent monitoring is recommended. Bracing. For moderate curves in children and adolescents, bracing can prevent further progression of the curvature. Physical therapy, exercises and stretching, in some cases, can help manage pain and improve posture. Surgery. In severe cases, you may require spinal fusion surgery. This is to stabilize the spine and correct the curvature. On the other hand, osteoporosis mainly affects older adults, particularly postmenopausal women, who experience a sharp decline in estrogen levels, which is a hormone that plays a key role in maintaining bone density. Osteoporosis is caused by weakening bones, which become fragile, leading to an increased risk of fractures. The joints that can become affected are mainly your hips, wrists, and spine. Vertebral fractures are particularly common with osteoporosis and can lead to significant spinal deformities. Your bone tissues are constantly remodeling throughout life, with old bone broken down and replaced with new bone. Osteoporosis is a bone disease that mainly decreases the density and quality, making bones more fragile and susceptible to fractures. The condition often progresses silently until a fracture occurs, typically in the spine, hip, or wrist. Age could be a risk factor for osteoporosis, as bone mass peaks in the late 20s and gradually declines with age. Menopause. Women experience a sharp drop in estrogen levels after menopause, which quickens bone loss. Nutritional deficiencies, lack of calcium, vitamin D, and other nutrients essential for bone health. Sedentary lifestyle. You can weaken your bones over time if you are physically inactive. Genetics. When you have a family member who has developed osteoporosis, you could be at an increased risk. Medical conditions. Conditions like hypothyroidism, celiac disease, and rheumatoid arthritis can contribute to osteoporosis. Osteoporosis is often called the silent disease because there are no symptoms until a fracture occurs. However, in advanced cases, symptoms may include back pain from fractured or collapsed vertebrae, loss of height over time, stooped posture, frequent bone fractures. The diagnosis is mainly made through a bone density test, such as dual energy X-ray absorptiometry, which measures bone mineral density, BMD. Osteoporosis treatment focuses on slowing bone loss, increasing bone density, and preventing fractures. The common treatments include medications. You may be given bisphosphonates, selective estrogen receptor modulators, SERMs, and parathyroid hormone-related medications, which can help slow bone loss and increase bone density. Supplements. The main supplements that help to keep your bones healthy are calcium and vitamin D supplements. However, you should always consult with your healthcare professional before taking any supplements, as some can interfere with your medication. Weight-bearing exercises. Regular physical activity can strengthen bones and improve balance, reducing the risk of falls and fractures. Hormone therapy. Estrogen replacement therapy may be recommended for postmenopausal women. Osteoporosis can be diagnosed through several methods, with the most common being a bone density test called a dual energy X-ray absorptiometry DXA scan. This test measures bone mineral density, BMD, in specific body areas, typically the hip and spine. The results are measured by something called a T-score, which compares your bone density to that of a healthy young adult. In addition to a DEXA scan, your doctor may use other diagnostic tools to assess your bone health. They include blood tests to measure calcium, vitamin D, and other markers of bone metabolism. X-rays to detect fractures or deformities in the bones. FRAX score, a tool that estimates the risk of fractures over the next 10 years based on age, gender, bone density, and lifestyle. The relationship between scoliosis and osteoporosis becomes more evident as people age. In older adults, osteoporosis can contribute to the development or worsening of scoliosis, particularly through vertebral compression fractures. These fractures can cause the spine to lose its natural shape and alignment, leading to or worsening the curvature seen in scoliosis. This condition, known as degenerative scoliosis, is common in older adults and often compounded by osteoporosis. However, if you have developed scoliosis, especially severe, it can increase the risk of fractures. The abnormal curvature of the spine places uneven pressure on the vertebrae, making certain areas more vulnerable to fractures. In postmenopausal women, who are at higher risk for both conditions, the combination of scoliosis and osteoporosis can lead to a cycle of worsening spinal deformity, increased pain, and higher fracture risk, making the management of both conditions critical to maintaining mobility and quality of life. Bone density plays a vital role in the progression of scoliosis. Low bone density makes scoliosis more susceptible or can worsen the condition, particularly in adulthood. Osteopenia, low bone mass, and osteoporosis may contribute to spinal deformities. Also, weak bones can be less effective at supporting the body's weight. Osteoporosis can be a risk factor for scoliosis, especially in older adults. As bone density decreases with age, the spine becomes more vulnerable to deformities. Osteoporotic fractures, mainly in the vertebrae, can lead to or worsen scoliosis in adults. This condition is known as degenerative scoliosis. If you already have scoliosis, osteoporosis can accelerate the progression of the curvature in the spine. This can lead to further spinal deformities, making it difficult to maintain posture and balance. This is especially concerning for postmenopausal women, who are at higher risk for both scoliosis and osteoporosis. Both scoliosis and osteoporosis share several risk factors, including age. In both conditions, the risk increases with age. Gender. Women are more likely to develop both scoliosis and osteoporosis, particularly after menopause. Low bone density. Individuals with low bone density are at higher risk for scoliosis and osteoporosis. Lifestyle factors, such as physical activity and smoking, can influence the risk of developing scoliosis and osteoporosis. A sedentary lifestyle, poor nutrition, especially low calcium and vitamin D intake, and smoking are all associated with decreased bone density and an increased risk of scoliosis and osteoporosis. The preventive strategies for both conditions include maintaining a healthy diet. Consuming adequate calcium and vitamin D is essential for bone health. Regular exercise. Weight-bearing exercises, such as walking, running, and resistance training, can strengthen bones and muscles. Avoiding smoking and excessive alcohol consumption. These habits can weaken bones and increase the risk of fractures and spinal deformities. The conclusion is scoliosis and osteoporosis are distinct but related conditions that primarily affect the spine and skeletal system. While scoliosis involves an abnormal curvature of the spine, osteoporosis is mainly due to low bone density and increased risk of fractures. There is a clear connection between the two conditions, particularly in older adults, where osteoporosis can worsen scoliosis and lead to further spinal deformities. Understanding the risk factors, preventive strategies, and treatment options for both conditions is essential for maintaining spinal health and preventing complications. Early intervention, lifestyle modifications, and appropriate medical treatments can help manage scoliosis and osteoporosis effectively. By working closely with healthcare professionals and adopting a comprehensive treatment plan, you can maintain your quality of life and reduce the impact of these conditions on your overall health. Thanks for listening to my video. I am not a medical professional, and the information in this video is for information only. If you have any worries about your condition, consult your healthcare professional. If you found this video helpful, please click the subscribe button to follow my channel and press the bell. If you have any questions, please leave a comment below, and I will get back to you. I hope this video has helped. Good luck.